Welcome, Sago and Spano. Here we are at the start of a new work week. We're fresh off the weekend, and the podcast is back up and running for June 8th. Lori Davis-Hill here, Director of Health Services and Incident Command of Pandemic Response for Six Nations of the Grand River during our current state of emergency. Within a week, a new beginning, let's take a stroll on over to our wellness section and see who has stopped by for a visit. Today, it's our pleasure to welcome Elissa Smith, Health Advocacy Officer with Home and Community Care. Hi, Elissa. Welcome and thanks for visiting us today. Tell us what you have to share with us today.
Hi, Lori. Thanks so much for having me, and it's a pleasure to be here with you today. So what I have to share with you is that coming up on June 15th, it's World Elder Abuse Awareness Day. So during these difficult times of COVID-19, elders can be at a greater risk of abuse and neglect. I encourage everyone to check in with elders regularly and porch drop necessary items so that we can keep our elders safe and socially isolated. At Six Nations Home and Community Care, we often use the term, elders are our gifts. And now is the time to express to our loved ones and elders how much of a gift they are to us by taking care of them. So some suggestions for families to share responsibility in caring of our elders would be to create a family group chat where members can post what items their family member is in need of. This way, the shopping and errands can be shared by everyone. One or two family members can contact the elder to see what items would be needed for groceries or also personal care items that week. So at this time, some of our elders are beginning to feel lonely or isolated. They miss seeing children, grandchildren, and other family members. So one thing children can do is create signs or posters to hold up at a distance for elders to see and enjoy. And these can also be posted on a porch or a window for the seniors to continue to enjoy and feel the love. Many of our elders are feeling left out of communication and information within the community. So always remember to keep sharing stories and update them about what's happening in the community or even within your own family. And just to remind them, they can get weekly updates on local radio stations and in newspapers. You can also provide phone numbers to community resources to elders, such as the Emergency Food Delivery or the Six Nations COVID-19 Assessment Center, so they can reach out if they have COVID-related questions. Another important discussion to have with a loved one is about substitute decision maker and or power of attorney. It's important for everyone to have an appointed medical power of attorney or substitute decision maker because in the event of a hospitalization, there can be a legal signing authority and decision maker to act on behalf of an elder. This is a really important conversation to have, especially now in the time of COVID-19, so that a decision maker is aware of a loved one's wishes, and in the event of an emergency, there would be limited access of communication between an elder and their family. So those are just some tips, but please feel free to reach out to Six Nations Home and Community Care at 519-445-0077 if you would like to learn more about our many programs and services. And also, on the Healthy Six Na Facebook page, we'll be having a contest starting on June 15th to share stories or post tips about how you are caring for our elders or helping the community prevent elder abuse. That's all I have for today, Sonyawa, for allowing me to share this information.
Thanks for dropping in and talking with us today, Elissa. We certainly appreciate you sharing your expertise in taking care of our elders. Wellness is a broad and diverse team, and the more variety we add in for our community, we provide just a little something for everyone during these definitely unique times we're in. From wellness, let's transition to the numbers. Provincially in Ontario on Saturday, June 6th, a report noted that 455 cases were confirmed. Of that, 68 were due to a reporting error. On Sunday, June 7th, 415 more were confirmed. However, 192 of those new cases were confirmed, and 223 of that were of the reported lab delay. The spike in cases are being attributed to the 20 to 29-year-old age bracket. Unfortunately, these are associated with the run of emotions resulting in mass gatherings that we've seen in the media. Here at home, Six Nations continues to stand at 14 cases of COVID-19. We have one active case. 12 cases are now considered to be resolved, and to date, our deaths among Six Nations is 1. We have tested 793 people so far. 761 people have shown negative results. We're waiting on 18 lab results, and 33 people are self-isolating on the advice of Oswego Public Health. A rundown of our neighboring cities and counties. Mississaugas of the Credit remains at 1 case reported. Haldimand Norfolk Public Health Unit had 395 cases and 139 resolved and 31 deaths. Brant Public Health Unit reports 113 positive cases, 103 resolved, and 4 deaths. Hamilton Public Health Unit reports 734 cases, 569 are resolved, and 41 deaths. And the Toronto Public Health Unit reports 12,538 positive cases, 9,623 are resolved, and 928 deaths. The increases in cases are being attributed to the resulting mass gatherings here in Ontario. However, we continue to advise that at this stage of the pandemic, we want you to follow all public health measures as have been asked. We do not want to see a new wave of COVID-19. We can keep you and your family safe. It's free. And how, you ask? Simple. Testing, testing, testing. A simple phone call to the Six Nations COVID-19 Assessment Center starts the process, and you can schedule an appointment. The COVID-19 hotline is open 7 days a week to take your calls. Please call, even if you have the mildest, simplest of symptoms, to put your mind at ease. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free at 1-855-977-7737. Again, it is really important to keep track of where you go and who you see on a daily basis. If you become sick, you will be asked about the past 2 weeks and specifically the last 48 hours before you started to have symptoms. Remembering this helps us to identify where you might have picked up the virus and where it might have spread. Please continue to keep Six Nations healthy and moving forward by wearing the mask in public, keeping your physical distance, washing your hands frequently, and cleaning high areas often. Yes, masks will protect us. They can protect the both of us. So why are we not wearing them? Let's make masks a fashion trend. Make them cool and fun. Before we meet up again tomorrow, I remind you that the Gneos Health Center COVID-19 operations requires that you use the front door only. You can access services only with an appointment. The Oswego Medical Clinic or Lab can be reached at 519-445-2251, and the Oswego Public Health Office is 519-445-2672. When you book an appointment, you will be authorized entrance to the building and will go through an active screening process to identify any symptoms. If you do not have an appointment, you will not be given access. If you or any of your family would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204. It's available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 at 226-777-9480 or by live chat Monday to Friday, 8:30 to 4, and you can reach that on the Six Nations COVID-19.ca website. Please keep our frontline workers here on Six Nations around the world in your minds and prayers. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.